Hi, my name is Shafiq. Today I will be talking about stages of Alzheimer's disease and its description. Alzheimer's disease typically progresses slowly in three general stages: early, middle, and late. But sometimes it is also referred to mild, moderate, and severe stages. And since Alzheimer's affect people in different ways, each person may experience symptoms or progress through the stages differently. So now that we know how many stages there are in Alzheimer's disease progression, let's talk about the description of each stages. So we'll start with stage number 1, the early stage Alzheimer's or mild stage Alzheimer's. So in this stage, a person may function independently. The person may still drive, work, and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting names or the location of everyday objects, maybe like keys and whatnot. So, the common difficulties during early stage Alzheimer's is coming up with the right word or name, difficulty remembering names when introduced to new people, having difficulty performing tasks in social or work settings, forgetting material that was just read, losing or misplacing a valuable object, and experiencing increased trouble with planning and organizing. And next is the middle stage Alzheimer's or moderate stage Alzheimer's. So this stage is typically the longest stage. It can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. So during this stage, the dementia symptoms are more pronounced. The person may confuse words, get frustrated or angry, or act in unexpected ways, maybe like lashing out. But in case if there is, let's say, there is a damage to the nerve cells in the brain, this can actually make it difficult for the person to express thoughts and perform routine tasks without assistance. So the symptoms for this stage may vary from person to person, but usually it includes being forgetful of events or personal history, feeling moody or withdrawn, especially in socially or mentally challenging situations, being unable to recall information about themselves, experiencing confusion about where they are or what day is it, requiring help choosing proper clothing for the season or the occasion, having trouble controlling their bladder and bowels, experiencing changes in sleep patterns, showing an increased tendency to wander and become lost, demonstrating personality and behavioral change, including suspiciousness, delusions, compulsive or repetitive behaviors. So at this stage, the person can actually participate in daily activities, but with assistance. So it is important to find out what the person can actually still do and try to find ways to simplify the task. And the last stage or the third stage is late stage Alzheimer's or severe stage Alzheimer's. So in this stage, the dementia symptoms are severe. Individuals lose the ability to respond to the environment, to carry on conversation, and eventually they will lose control movement. They may still say words or phrases, but communicating pain become difficult. As memory and cognitive skills continue to worsen, significant personality changes may take place and individuals need extensive care. So at this stage, individuals may require 24/7 assistance with daily personal care, lose awareness of recent experience changes in physical abilities, including walking, sitting, and eventually even swallowing, and have difficulty communicating and become vulnerable to infections, especially pneumonia. So at this stage, the person may not be able to initiate engagement as much as how they are able to back in the earlier stage. But the person can still benefit from interactions in ways that are appropriate. So if let's say the person with the Alzheimer's disease is your parents, how do we need to treat them exactly? It's easy. We need to treat them with love, care, and respect, just like how you would before. Nothing changes. So let's say if maybe you are going outside for dinner or lunch, bring them together with you. Although they may not be able to eat with you, talk with you, it's absolutely fine. Just make them feel included. Talk to them about your days, tell them about your stories, what's been going on, what's happening. Just tell them. Or maybe even better, take a stroll with them at the park or something like that. Just try to make them feel included, loved, appreciated, and that they are not a burden to us. And that is all from me for now. Thank you very much for listening.